Palliative care, at least within medicine, is a discipline that is focused on helping patients who have conditions that are no longer curable, who still are not at the very end of life when they may be a candidate for, say, hospice care, but are now beyond cure. That's going to be a balancing act between two ends, right? Relieving the pain, but the side effect of the medicine that may cause extra sedation or even hasten death. My intent is not to hasten death directly, although if that's a side effect of a medication, I'll tolerate that effect if it's tied to my primary intention of relieving pain.
No one should die in pain. In fact, the Catholic Church is very clear about the use of pain medication. We can use drugs to control pain, even if we know that it might lead to an earlier death. But the intent is to provide comfort as someone is facing an inevitable death from a chronic and progressive disease. The Church has been very clear about that. No one should die in intractable pain.
You have to balance what it is you're talking about with what the intent of what you're trying to achieve, and then the circumstances that are involved with achieving your goals. If it's about pain relief and reducing suffering, that's going to be a balancing act between two ends, all right? Relieving the pain, but the side effect of the medicine that may cause extra sedation or even hasten death. From an intention standpoint, I as a physician want to work with my patient to achieve the former goal, and that is to relieve or reduce pain. And note here that I'm not thinking of actively using a pain medicine to hasten or cause somebody's death, because now my intent has changed from relieving pain to causing death. And so it's important. This ties to something called the principle of double effect.
And the principle of double effect has four parts to it. The first part is that the act which you choose to do has to be morally good or neutral. Second part of the principle of double effect says that the good effect is the one you intend. The bad effect you don't intend, but you foresee it. Thirdly, the good effect cannot be caused by the bad effect. And then the fourth part of the principle of double effect is that there has to be a serious reason, a proportionate reason for taking this action, which has this foreseen but not intended effect.
Many times you can bring someone's pain down to a manageable level. So if we're operating on a 10-point scale, you could take their pain down from a 10 down to a 3. You probably can't bring it to a 0. There are some patients who really want their pain to be 0. They don't have any pain. They want 0 suffering. I usually have to have a conversation with them to say that may not be realistic. Because at some point, in order to achieve a pain level of 0, I would actually be using that pain medicine in a way that would be harming you, not just allowing your death to come more quickly, but actually actively hastening your death. And I've taken an oath not to do that. I'm not a proponent of a lot of suffering. We take great efforts to try to reduce and relieve suffering. And we need to acknowledge that it does exist. And in a strange way, there can be value to what suffering brings out in others. It can bring out the worst in people, and it can sometimes bring out the best in people.
But it's a mystery, and the only way to really understand it is in the context of love.
There's dimensions of life that are not a puzzle to be figured out or a problem to be solved. There are metaphysical things going on. We can't touch them. It's like air. You breathe it, you know it's there, but you can't see it. You can feel it only if the wind is blowing. But there's other dimensions of our humanity that are like that. I like to look at the Gospels. Even our Lord had a passion. Even he experienced a painful death, And is there something noble to suffering? One of the most wonderful pieces I've ever read called Salvifici Doloris. And in it, he does a beautiful exposition of bringing meaning into suffering by uniting it to the suffering of Christ. And without that connection, it can be harder to make sense of suffering, other than maybe on the human level. Again, it can bring out the best of people who want to help to reduce that suffering in a way that they find meaningful.